Hey everyone, it's Miss Baker, and we are going to go over insurance and healthcare's role in the economy. So, as we discussed in our last unit, the US spends a great deal of money every year on healthcare. So, this PowerPoint was written prior to the updated numbers I gave you last unit. So, since these are the numbers that you used for your notes, this is what we will go with for the exam. So according to this, 2.7 trillion or $9,816 per person was spent on healthcare in 2011, and roughly 50 million people were without healthcare insurance. It was projected that by 2015, the average cost per person on healthcare would be $12,320. We've learned, however, that the actual number is a little less. It's around 11,000 and something. Um, and that is largely due to the Affordable Care Act and the availability of health insurance for a large number of people, bringing down the cost of insurance. One of the problems, however, that arose in regards to so many people not having access to health care, they don't have insurance, so they can't go see a doctor, is that people use emergency rooms for primary care. This means instead of having the ability to schedule an appointment with a primary care physician if they get sick, they end up going to the ER for things that would normally be treated at your doctor's office. And so by doing so, they're receiving treatment that they wouldn't otherwise have access to. However, the cost of getting the same treatment in the emergency room is much higher. So, health insurance does several things, but the biggest thing is that it decreases out of pocket expenses for healthcare services, meaning that a person doesn't have to pay as much of their own money when they receive some form of health treatment. So before insurance came about, people were 100% responsible for the cost of health care that they received. Now, however, they share those costs, those expenses, with the health insurance company. The majority of people have health insurance through their place of employment because individual health insurance policies are typically much more expensive to pay for. So, you might be asking, what exactly is insurance? So, insurance is a method that enables people to protect against loss from or against life, property, and other assets like income. So, basically, when you have a house, you have house insurance, home insurance. And this is because if something happened to damage your house or someone broke in and stole something from your house, your owner's insurance would pay for either the repair or the replacement of your home. You have car insurance to protect against an accident that may occur or theft that may occur. It's not going to prevent it from happening, but if it does, you have the ability to have access to money so you can either fix your car or replace your car, depending upon what occurred. So, having health insurance is not going to keep you from getting sick. However, it's going to reduce the amount of money that you have to pay for access to health insurance. So, instead of paying for everything out of pocket if you get hurt or sick, you only pay for part of those charges. So, multiple people and organizations that employ people contribute to what is known as a premium, or they contribute premiums to a pool of money. And remember, the premium is the set amount of money that is paid every month by your employer or by you so that you have access to health insurance. And you pay this money regardless of whether or not you use your healthcare benefits. If you are super healthy and you never have to go to the doctor, that's great, but you still have to pay your premium. If you're sick all the time and you have to go to the doctor all the time, That's not so great, but you still have to pay your premium in addition to your other expenses related to healthcare. But this pool that we're talking about is a collection of money that everyone pays into so that when somebody does get sick and the health insurance company has to pay to cover those expenses from the sick person, they draw from this pool of money. And it's there because not everyone who pays into it gets sick and needs access to that money. And they called that a shared risk pool, meaning that more people are paying into it than the number of people who actually need payment from that source. So, when you are purchasing insurance, like we stated a moment ago, if you purchase health insurance on your own, it's typically going to charge or cost much more. So the cost is greater when you purchase it by yourself, an individual policy. So typically, companies will purchase health insurance for their employees because when you purchase health insurance in a large group, you can get a more affordable price in regards to the premiums. So it meaning it doesn't cost as much every month because you're purchasing the policy for a larger number of people. It's like when you buy in bulk, you are paying less per item versus if you go and buy one of those items at a convenience store. If I were to go to 7-Eleven and purchase a small bag of chips, it's going to be more expensive for that one bag than if I went to Costco and purchased a large quantity of multiple bags of chips. So then when you break the price down, each bag of chips is much more affordable when you purchase in bulk versus if you just go and purchase one on its own. Same thing. You purchase health insurance, one policy on its own, it's going to cost a lot more than if you purchase a large amount of insurance for multiple people, such as when companies purchase health insurance for their employees. Now, remember that when you have health insurance through your employer, through your place of employment, you're able to keep that insurance as long as you work there, meaning your eligibility depends upon your continuous employment. So I have health insurance through Round Rock ISD. I will have this health insurance until I no longer work at Round Rock ISD. As soon as I leave my job, I no longer have that health insurance policy. So again, eligibility is dependent upon your continuous employment, meaning as long as you work at that place, you are eligible to keep your insurance, but as soon as you leave, either you quit or you're fired, you no longer have access to that health insurance policy. When you get a new job, you would get health insurance from your new place of employment. Typically, to be eligible, an employee would have to work at least 20 hours or more a week. 20 would be the bare minimum that you could get by working and perhaps be eligible for health insurance benefits. And most companies have a waiting period before your health insurance benefits are available. Meaning, if I started work on January 1, I might have to wait 30 days or 60 days before my health insurance kicked in. So I would have to work for my first 30 days or 60 days on the job without health insurance coverage. And then at the end of that waiting period, my insurance would kick in and I would have access to those benefits. And this statement here, pre existing conditions may be ineligible. Before the Affordable Care Act was passed in 2011, this statement was true, meaning any condition that you were diagnosed with before you got that health insurance policy would be considered a pre existing condition. And health insurance companies had the option of saying that they would not cover any treatment related to that condition because it was a pre existing condition. Examples of this might be heart disease, diabetes, a history of cancer. So, if you had any one of those, and then you got your health insurance policy, and they declined to pay for anything related to that diagnosis, if you had to have treatment for anything related to that at all, you would have to pay for the entire cost on your own. The Affordable Care Act said, no, this is not okay. And they made that policy illegal. So, right now, health insurance companies are not able to deny you payment for procedures or services that you have to have related to what would have been considered a pre existing condition. Ladies, if you were pregnant and then you got health insurance, they could have said your pregnancy was a pre existing condition and denied paying for any of your prenatal care and any of the cost associated with the delivery of your baby at the time of birth, because they would have said, nope, sorry, you being pregnant is a pre existing condition. We're not covering it. Now that is illegal to do. So let's talk about different terms and what they mean. So, deductible copayment and coinsurance are different ways that health insurance companies are able to control the cost of what they have to pay on your medical services. So, when you have a health insurance plan, you're responsible for the deductible, you're responsible for the copayment, and you're responsible for part of the coinsurance, meaning that you have to share the cost of your care with the health insurance company. So the deductible is what you pay in full before your insurance begins to pay anything. Your copayment is a set amount that you pay at the time of service every single time you have that service. An example of this would be when you go to your doctor, you have to pay a copayment every time you walk through the door prior to being seen. Basically, you are agreeing to pay them a set amount just for them to agree to see you. They see you, and then there's an additional bill afterwards in regards to the actual cost of the visit. The copayment is your fee that you pay for a service at the time you receive that service. Coinsurance is talking about the percentage of expenses that are shared between the insurance company and you, the patient. It is typically written as a fraction. So here you see an 80-20 coinsurance plan. You might see it written as a 90-10, a 70-30, a 75-25. Whatever the percentage is, meaning the percentage that of the bills that the insurance company pays and the percentage of the bills that you're responsible for, you could tell by reading this number. The first number is what the insurance is responsible for. So in this example, for any bill that I received after I paid my full deductible, they would have to pay for 80% of the cost of that service. I would have to pay 20% of the cost of that service. So if there was an office visit that cost $100 total, the insurance company would pay $80 of that 100 and I would have to pay $20 of that 100. We're splitting or we're sharing the cost of expenses. Now, there are multiple types of insurance plans. We have an HMO, which is a health maintenance organization, a PPO, which is a preferred provider organization, and an agency plan, which is also referred to as a high deductible plan. Insurance that you have through your employer is referred to as private insurance. So let's talk about an HMO. So, an HMO, health maintenance organization, is a type of managed care medical insurance. You can go to a very specific list of physicians, and these physicians have an agreement with the HMO to provide treatment to you. Um, they are contracted basically with the insurance company to provide care. So you would go to your physicians for all of your regular care as well as any sort of specialty treatment that you might need. However, in order to get access to that specialty care, you have to first go to your primary care physician and get what is referred to as a referral, which is basically a permission slip to go see a specialty physician. If you don't do that, if you don't go get that referral, your HMO may, most likely will, deny paying for any care that you received from your specialty physician because you didn't have that special permission slip. So if I needed to go see my neurologist, I would have to first go see my primary care physician, get a referral, take that referral, and then I could go see my neurologist. I couldn't just make that decision to go on my own because I have an HMO and I have to have a referral in order to receive specialty care. Again, if I were to go without the referral, I would be responsible for paying the cost of that visit 100% on my own. A PPO stands for Preferred Provider Organization, and this type of insurance plan has a list of providers like doctors and clinics and hospitals that are referred to as a preferred provider. Preferred providers have contracts with the PPO to provide services for a set fee. And you, the insured person, can choose from this list of preferred providers when trying to decide am I going to go see for medical care. Um, if you need specialty care, you are allowed to go see a specialist often without the need of a referral. So, in this instance, if I needed to go see my neurologist, I could just call my neurologist and schedule an appointment on my own without having to go to see my primary care physician first to get that special permission slip. Now, physicians that are on the preferred provider list, they have a contract to provide services at a discounted rate in agreement to working with the insurance company to accept payment from them. So you may choose to go see any clinic or facility or doctor from the preferred provider list. And as long as they are considered in network, then they are agreeing to take a slightly less amount of money in order to see you. If you go to someone who is not on the in network list, if you see someone that is considered out of network, then the PPO may pay some money towards that cost. But since they are not on the preferred providers list, most likely you're going to be paying more out of your own pocket for seeing someone out of network than if you stick to the in network list of physicians. So, an agency plan, again, a high deductible plan. These insurance plans have fees that you pay upfront, your premiums, that may be less money every month. However, the trade off for paying less money every month is that when you do need medical care, you're going to pay for a larger portion of that care at the time you receive it, meaning you're going to have a larger deductible and your coinsurance percentage, your part of it, is typically going to be larger than with your usual HMO or PPO. Um, so, one benefit, however, is that you have a greater freedom in terms of choosing from a list of doctors. And if you are a person that is fairly healthy, that does not need much health care throughout the year, if any at all, this may be a very good plan for you because the likelihood of you needing health care and having to pay these higher amounts is not very great. And so, as a result, that monthly fee that you have to pay, regardless of whether or not you use your insurance, your premium, you're paying less every month than you would with a traditional HMO or PPO. So, all of that means is that you are paying less of your own money every month, and the likelihood of you having to pay for greater amounts for getting sick is less because you don't get sick very often. Now, if you were to get sick or hurt, then yes, you would have a greater portion of the cost that you would have to pay versus what the health insurance company would have to pay. But the likelihood of you getting sick or injured is less if you're a healthy person. Now, if you're like me and you're sick all the time, this is not the way to go. So, other types of insurances that may be provided by your employer. You have your life insurance, vision, dental insurance, long term care, cancer, and disability. We'll briefly define them as because we will discuss them more in depth on a later slide. So, life insurance provides a financial payment to a beneficiary at the time of death. A beneficiary is a person that you have named to be the recipient of that money when you die. There are two types, term life and whole life, and we will talk about the differences between them later on in this lecture. Vision insurance may pay for part of your eye exam or your glasses or contact lenses. Dental insurance covers a portion of teeth cleaning, fillings, x rays. Some orthodontic care and some oral surgery may be covered. Long term care provides nursing home care or home health personal care for people who are age 65 or over with chronic or disabling conditions that need constant supervision. Cancer insurance is a special insurance policy used in addition to your regular medical insurance, health insurance, and this is used specifically for the treatment of cancer. Disability insurance pays part of your income upon disability, meaning upon becoming ill or injured and having to miss a large amount of work. So when you miss work, you don't get your paycheck. Disability insurance will help provide some income in the event that you have to miss a great deal of work because of becoming injured or sick. And we'll talk about each of these more shortly. All right, types of government insurance. So these are the different types of government insurance plans, and we're going to talk about each one. TRICARE or Champus is a government financed health insurance plan that has been developed for their own employees. Basically, you're looking at military personnel, both active and retired, and the military personnel's family. They are able to see a physician from a very specific list of doctors, but any care that they need, they have access to through this insurance plan. Medicare is the nation's largest health insurance program, and it provides health insurance for two different populations, people aged 65 and over, and people who are under the age of 65 who have a disability. And this program is partially paid for through payroll taxes. So when you start working and earning a paycheck, you'll notice that one of the taxes that is automatically taken out is the Medicare tax. So every person who works in this nation pays into Medicare, and it happens automatically every time you get a paycheck. So if you get one paycheck a month, you pay one chunk to Medicare. If you get two paychecks a month, you pay your Medicare taxes each and every time. Medicaid is a program that is funded by both state and federal government. It provides health care for citizens who are low income and fall in to the groups of either families, children, elderly, or the disabled. In order to qualify for Medicaid, you do have to meet certain income requirements, meaning there's a set amount of money that you are not allowed to earn more than, otherwise, you do not qualify for Medicaid because it is geared to provide healthcare coverage to people with low incomes. So, even though both federal government and state government fund Medicaid, it is the state government that determines eligibility rules and also what Medicaid covers. So, what services are covered by Medicaid. And these requirements and what Medicaid covers varies or differs from state to state. So, if you qualified for Medicaid here in Texas, and you move to Kentucky, you may or may not qualify for Medicaid there because their requirements and eligibility requirements may be different. Um, Conversely, if you don't qualify for Medicaid here and you move to Kentucky, you may find that you do, again, because each state sets their own eligibility requirements and they are not dependent upon any other states. So each state is independent. CHIP is Texas's Children's Health Insurance Program. It is an insurance program controlled by the state, and they provide health care to uninsured children of working families who make too little money to be able to pay for a private insurance plan, but make too much to be eligible for Medicaid. So, what you end up with is a gap of people who are uninsured because they make too much to pay to qualify for Medicaid, but they don't make enough to be able to pay for health insurance on their own. So, you have this chunk of people who are uninsured. Data has shown that if children have access to health care, they are typically healthier, they live longer, they do better in school, and overall things are greatly improved for them if they have access to medical care when they need it. So the state developed the Children's Health Insurance Program to provide health insurance for families who can't qualify for Medicaid but can't afford health insurance. So the adults remain uninsured, but the children of these working families do have health insurance and have access to health care. Workers' compensation is another insurance that is controlled by the state. And this is an insurance plan that will pay for treatment for a person as well as pay for their lost wages, meaning their lost earnings that they have suffered due to either injury or illness that was obtained or caused by their job. So if I were walking on campus and I fell and broke my arm, I was injured at work. So workers' compensation would pay for the treatment of my arm. And if I was off work any period of time, workers' compensation would pay me my salary or part of my salary for the time that I was off work because I was injured at work. I would not have to use my private health insurance because this accident happened at work. Now, if I leave work and I go home and I fall and break my arm, that did not happen at work. So workers' compensation would not pay for that. My private health insurance would have to pay for that. A health savings account is a type of special savings account that is a medical savings account that is used by a person to pay for current and future medical expenses. Essentially, what happens is you designate a certain amount of money to be taken out of your paycheck every time you get paid. And they take this money out and they put it in a special savings account that can be used for medical expenses only. So you can use it for your co-payments, you can use it for your medication expenses, you can use it to pay bills from your doctor's office or a hospital that you might get after you've had a procedure or you've gone in for a visit of some sort. So, a special medical savings account that allows you to save money, set it aside, and then when you need to use it towards medical expenses, you can take that money and pay for those medical expenses. These types of savings accounts you will often find that a person has, especially if they have a high deductible health plan. Remember that agency plan that we talked about earlier, where you pay a lower premium, but when something happens, your out of pocket expenses, the cost of care, you have to cover more of it because you're paying for a lower premium. Well, an HSA would allow you to have some money saved up so that if something did happen and you had to pay for a greater chunk of your medical care, you have medical savings set aside to go towards that. So often you will find that if somebody has a high deductible health plan, They also usually have a health savings account as well, so that they are able to set money aside so that when they do need to pay for health expenses, they have access to funds to do so. Cancer insurance, we mentioned again, it is special insurance to pay for the treatment of cancer. And you would have this policy in addition to your basic healthcare insurance, not in place of. It would be an extra policy on top of your basic health insurance. Disability insurance. So again, this insurance is providing income in the event that you miss work due to disability. And in this instance, disability means that you have been injured or that you have been ill, but something has happened and you've had to miss a good chunk of time from work. So there are two types, short term and long term, and which one actually covers your income is dependent upon how long you are out of work. So short term may kick in. One other thing is that typically there are waiting periods before this insurance would kick in and start to pay part of your income, meaning you would have to be off work for a set period of time without pay. Then, after you have met that waiting period, your disability insurance would kick in and start paying a portion of your income after that point. For example, what you see on the screen is after you have been off work for 4 weeks without pay, then your short term disability would kick in and pay approximately 60% of your income. If you were still off work after 12 weeks, then your long term insurance might kick in and pay 80% of your income. Exactly how long your waiting periods are and exactly how much, meaning what percentage of your income the disability insurance would pay, varies from policy to policy. So it would be dependent upon which policy you had through your work. But just understand that disability insurance often has a waiting period, and there are two types, short term and long term. And when they do pay, they're paying you part of the income that you've been missing because you have been out of work for a prolonged period of time due to either injury or illness, collectively referred to as disability. Vision insurance is great for people like me and who can't see at all without the aid of glasses or contacts. So, vision insurance will pay for part of or all of an eye exam and will often give you money to go towards the cost of glasses or the cost of contact lenses. Rarely will it cover both. So, if you do wear contacts sometimes and glasses another time, usually you can get like one amount to go towards one or the other, and then you would have to pay for the non-covered item out of your own pocket. But at least vision insurance pays a portion of it. Dental insurance often covers a portion of your teeth cleaning, fillings, x-rays. Sometimes it'll cover certain orthodontic care procedures, and sometimes it'll cover part or some things related to oral surgery, meaning surgery that you have in your mouth related to teeth and gums. Most of the time, there is a limit on the amount of orthodontic care that your insurance company will pay for through your dental insurance. Anything not covered beyond those limits, you would have to pay out of pocket. Life insurance, we mentioned, we have two types, term and whole. And life insurance is a policy that you have access to. You pay a monthly premium. And then when you die, a person that you have designated as your beneficiary will receive a lump sum payment it, when you pass away. So basically, if I had a $25,000 life insurance policy, when I died, my beneficiary would receive $25,000. And again, you're paying your monthly premium so that you can have this policy. If you quit paying your premium, your life insurance goes away. And then when you die, your beneficiary gets nothing because you let your policy lapse or go away. So when you pay your premium every month, you will keep your life insurance. And then in the event of your death, your beneficiary gets money. Um, a lot of times, your job will offer life insurance to you at no cost that is equal to the amount of your annual salary. So if you were to make $75,000 a year, your job most often would offer a $75,000 life insurance policy to you at no charge. You may have the option, like you did in the worksheet that you did, to pay a little bit every month to double or triple that amount in the event of your death. So, like in the worksheet, you could pay maybe $2 a month, and that would double the amount of life insurance. So, your beneficiary would get $150,000 instead of 75,000. If I paid a little more every month, I could triple it and my beneficiary would get $225,000 when I died versus just the one annual salary of 75. Oh, and the last thing is that individual policies may be purchased, meaning that through insurance companies, you can pay and purchase your own individual life insurance policy without having to go through your place of employment. So you might have life insurance through your work, and you might have a life insurance policy through your company. So let's talk about the two types of insurance plans. There's term life insurance and whole life insurance. So they each have their benefits to them and their drawbacks. So term life is typically more affordable, meaning the premium every month is usually less than what you would pay for a whole life insurance plan. The downside to term life is that you have to fall within a particular age range in order to qualify for a term life insurance policy. The benefit is that that's usually the only qualification that you have to meet in order to be eligible for term life insurance, meaning you don't have to undergo a health exam. You don't have to worry about your medical history. So, if you've had cancer before, that's okay. If you have a history of heart disease, that's okay. If you have diabetes or other illnesses, that's okay. It's not going to affect how much you pay every month. So, as long as you fall within that age range, and if you die within that age range, then your beneficiary gets your term life insurance money amount that your policy was worth. Now, the bad side is you're paying into this every month. And if your upper limit is 50 years of age for term life, as soon as you turn 51, you no longer have access to that insurance policy. So everything that you've paid into it goes away. It basically disappears. Poof, it's gone. So you no longer have access to that policy because you don't qualify anymore because you're too old. Now, whole life insurance is a completely different matter. It sticks with you your whole entire life. That's how I like to think of it. Um, the downside is that your whole life insurance premiums are typically more expensive because you have to qualify for a policy. You typically have to undergo a health exam. They'll do blood work. They'll consider your medical history and your family medical history. So, if you have a history of cancer, either yourself or in your immediate family, that's going to make your policy premiums more expensive. If your blood work is horrible and you have high cholesterol and or you come back as diabetic, you're going to pay a higher premium. Um, so any of those things will contribute to more money every month having to be paid for this insurance plan. But the upside to this plan is that it doesn't go away after you get a certain age. It will stick with you literally until the day you die, as long as you're paying your premium. So when you do die, your beneficiary will get the amount that your policy was in. Now, there's one other good benefit to whole life insurance. So you've been paying your premium year after year after year. So you've had this policy for a long time. Now you have retired. Maybe money's a little tight. and you could use a little extra to cover living expenses. With a whole life insurance plan, you can actually take money out that you have paid in, and you can take it out as a pension, meaning you can take it out as a retirement paycheck, and you can use that payment towards living expenses to make your cost of living a little more bearable at the time, make your living standards a little more comfortable. So, with term life, you have to fall within a particular age range, but your premiums are lower and you don't have to do any medical exams or anything like that. You're guaranteed insurance. With whole life insurance, your premiums are going to be more. However, the policy sticks with you your entire life. And when you retire, you are eligible to take out some of that money that you've been paying in out as a retirement payment, also referred to as a pension. And the only thing that that does is reduce the amount of money that is left over to go to your beneficiary when you do actually die. So, when we look at national health reform, we have millions of people in this country that are uninsured. Um, we spend more money than any other nation in the world on the cost of healthcare. However, our outcomes are worse than 24 other developed nations in this world. So we're spending more, but people aren't any healthier and aren't living longer than people in 24 other developed nations throughout the world. So there is an obvious disconnect in the amount of money that we're paying and the benefits that are occurring as a result of this. So when we compare ourselves to the rest of the world, only approximately 40 out of over 200 countries have organized healthcare systems. And the majority of the world has to pay cash before they have access to any sort of healthcare services at all. The majority of the world does not have health insurance plans that are set up. They do not have healthcare systems that are set up. So, if you needed medical care of any sort in these countries, you would have to seek out where to go, and you would have to pay in cash before you could get any sort of treatment at all. When we look at the United Kingdom, they have the National Health Insurance Plan, which is financed by taxes, and every single citizen in the United Kingdom is covered with health insurance. So the benefit is that the costs of healthcare are much more tightly controlled. However, access to equipment is very limited, and there are great delays in procedures getting scheduled for people when they have non-emergency procedures that they need done. So everyone is covered by health insurance. However, there's a great demand on their healthcare system so that procedures that are not considered emergencies often have to be scheduled out pretty far in advance. Germany has an employer based insurance plan and it's financed by both the employee and the employer. However, every citizen in Germany is covered by health insurance. So again, you have very tight control of the cost of healthcare, but because you have so many people that are insured, you have limited access to equipment, and that can sometimes lead to delays in receiving treatments for certain things that you may need. So, the Affordable Care Act, also referred to as Obamacare, was um, passed in 2011, 2012. Um, and it came about due to the question of, is healthcare a right or a privilege? Meaning, is it a right for every person to have access to quality healthcare, or is this something that is a privilege? And during the Obama administration, the legislators took the stance that it is a right that every person should have access to quality health care. So the Affordable Care Act was drafted and passed into legislation, providing everyone the ability to purchase health care who did not have access to it through their place of employment or didn't qualify for Medicaid or Medicare. So, key components of the Affordable Care Act is that it eliminated many health insurance company abuses, meaning that health insurance companies previously were able to deny you coverage for certain conditions because they called them pre existing conditions. Remember, we talked about that earlier in the lesson. This made it illegal for them to deny you coverage. Um, the goal was to cover 94% of all Americans by requiring all people to purchase health insurance by 2014. And by requiring everyone to have health insurance, this would slow down the cost of health care, that increasing amount that is being spent year after year after year. Hopefully, the goal was that hopefully by having more people with access to health care and who had health insurance, that this would help alleviate or slow down that increasing cost of health care. So it was passed through careful maneuvering by the Democrats and through working across the aisle with Republicans. Um, and it was a very difficult thing to get past. We will discuss this much more in depth after your exam. I didn't want to get into it too much prior to the exam because it's a very complex thing. But these are just the basic things that you need to know for the test. So it was very difficult to get it passed through the legislation in Congress. There have been multiple court challenges that have come about. And one of the key issues is, can you require everyone to actually pay for health insurance? And the decision was yes, held up by the Supreme Court in June of 2012. Now, the Republicans have been trying to repeal or strike down the Affordable Care Act. And in fact, starting tomorrow, your test day, the Supreme Court is beginning to hear arguments on the Affordable Care Act to decide what is constitutional and what should be struck down. So either it will stay as is, certain parts of it will go away, or it will be struck down completely. So at this point, the Republicans are no longer able to make the decision um, on what is struck down. Now it's in the hands of the court, and we shall see what they say. So there are pros and cons to the Affordable Care Act. The pros is that the goal was to cover 94% of Americans, that it was going to eliminate key insurance company abuses, meaning limiting how much um, they would cover. There were limits set, lifetime limits that insurance companies could put into place so that if you hit that limit, then they could deny you coverage for anything beyond that forever. They are not allowed to do that as a result of the Affordable Care Act. The ACA creates regional insurance groups to allow for bigger groups. Remember when we talked about more insurance that you're able to purchase in a larger group means that you pay less for the premiums? Well, this allowed people to get into regional groups so that they could have a lower premium versus trying to purchase a policy all on their own, which would result in a higher premium. The ACA did require all people to purchase a health insurance plan, or they would have to pay a penalty on their income tax, a $750 penalty. That $750 penalty has since been struck down and by the Republicans, and so that is no longer the case. And it allowed government systems to use existing programs to extend care for the poor. So some states elected to participate in what they called Medicaid expansion. So by agreeing to this, they agreed to take money from the federal government to increase the number of people who were covered by Medicaid. So, do you remember that group of people that we talked about who made too much money to qualify for regular Medicaid, but not enough money to be able to pay for health insurance on their own? So, they were left without insurance. Well, if their state elected to participate in this Medicaid expansion through the ACA, then their state had more money to cover some of those uninsured people. Unfortunately, Texas did not participate in this. So, as a result, we have one of the highest numbers of uninsured people in our state versus other states in the nation. Now, those are the pros for the ACA. There are some cons, meaning everybody has to pay into it. Remember, at the time it was passed, if you didn't pay into it, you had to pay a $750 fine on your income tax. Um, Regional insurance groups unfortunately created policies that were more expensive than what the ACA had hoped. And so it made some of these premiums still more expensive than what people were able to afford. The law itself is over 1,000 pages in length, and it's very difficult to understand exactly what all is contained in it. An average person would have difficulty sitting down and reading all 1,000 pages and understanding everything that the Affordable Care Act covers. Um, the cost estimates were actually lower than what the reality was. So, not as much money was saved as initially hoped. And then the big struggle, which is the everlasting question of how do we pay for this? Again, providing health care to 94% of all Americans is not a very cheap thing to do. So, where does the money come from? Is a question that is still being debated. So we will look at in another video an example of how you might see some questions asked on the exam because you need to understand the definitions and you need to understand how these terms are applied in a real life scenario. So for now, I hope that this has helped you understand the PowerPoint a little better and understand what you need to know for the test. Remember that it is open note, so make sure that you've gone through your notes. You've taken any extra notes that you feel necessary to help you understand. And good luck to you studying. And if you have any questions, make sure that you email me. So good luck, and I will see you in class.